Hey, Dr. Tyler Williams with Better Sleep SLC. Thanks for checking out this video today. You're here because you have some questions on remedies for snoring, or your bed partner snoring, or you may wake yourself up snoring. Often there's a lot of these problems in relationships and people end up sleeping in separate rooms, or if you're single, maybe it wakes you up from time to time and you're not getting a good night of sleep. Or it can be embarrassing when you travel or go camping with friends or family members, or you share a room with someone. So many people come and see us because of problems with snoring. And there are two main issues with snoring. The first one is the sound. Obviously, it can be bothersome to you or other people. And then the second one are the health consequences. Often snoring is associated with gasping or stopping breathing. And if this is something that's bothering you, or you feel like maybe a problem, don't hesitate to call us or text us. Our information is below this video. We can send you a guide that kind of walks you through things to look for and see if you would be a good candidate for a consultation to learn more about different treatment options that could benefit you. But back to the issue of snoring and remedies, there are a whole bunch of things you can get over the counter. Everything from wax earplugs to block out the sound of someone else. There are straps that can go on your jaw. There are over-the-counter devices you can buy for your mouth. There are things that can help you sleep on your side. Generally, people sleep a bit less on their side. And all of these things have their place. There are beds that recline, different types of pillows. We found that all of those things can help support or improve your snoring. But treating snoring really comes down to three main options for most people. That is some type of surgery. Generally, that's more of a backup option, but it can be a great option for some people. An oral appliance, which is a device you wear on your teeth. That's the niche at our office at Better Sleep SLC. This device you wear. So this is what we would call a Mallampati score, and you can do this on yourself by looking in the mirror and sticking your tongue straight out. So you want to be kind of sitting up, tongue straight out, open wide. Don't say ah or swallow or anything like that. Just look at where your tongue naturally sits when you stick it straight out and your mouth is open. And that'll give you an idea of where you rank. And 4 is generally the worst. 1 is generally the best. Just because you're a 1 or a 4, it doesn't always mean that it's good or bad. But generally speaking, we see a lot of people who are in the 2s and 3s and 4s where it's very easy to spot snoring issues or sleep apnea issues. We see plenty of people in the 1s who still have a snoring or a sleep apnea issue. But the higher you are on this Mallampati rating, the more likely you are to have sleep apnea as a result of your tongue size. So often people will have a small mouth and a normal sized tongue, but effectively your tongue is now large for your mouth because your mouth is smaller. This can often happen from having teeth removed for braces, or losing teeth from root canals that went bad, or accidents, injuries, lots of dental work, those kind of things. And your mouth will shrink. And so it's important to maintain your jaw size as much as you can. But doing this will help you understand why people snore. Even if you're at a 1 or a 2, when you lie on your back or sometimes your side and you sleep, your muscles are going to relax, and your tongue is a large muscle. And so it will relax and fall backward and fully or partially block your airway, and it makes that snoring sound. So when you think about this, it's similar to a car. If a car gets in a fender bender and it bends or pinches the muffler, or maybe you hit a rock and that muffler gets constricted, it's going to make more of a whining sound. And that's what's happening when you snore. Or with age, the back of our throat loses elasticity, so it gets closer to that tongue and can cause more of that turbulent air sound and out of the way and allow air to flow through. And then the third one is a CPAP, which blows air continuously through your nose and or mouth and blows it hard enough that it pushes past that tongue blockage so it can inflate your lungs with air. They all have their place. They're all different, but generally those are your treatments for many types of snoring, which is linked to sleep apnea. Obviously, there are health consequences if you stop breathing multiple times throughout the night or gasp or wake yourself up gasping. You're probably stopping breathing many more times during the night. You just don't even know that it's happening. And what we'll show you at the end of this is ways you can look in the mirror and self-assess why you may be snoring or why your bed partner may be snoring. And then you'll have more information on making a decision and making the next steps. So thanks for taking a minute to watch this video. We hope that you can use some of these remedies and over-the-counter things to supplement your treatment, one of the 3 types of treatment. But most importantly, get an assessment from a qualified sleep facility or a dentist that's trained in sleep medicine that knows how to not only just make you an oral appliance, but also knows how to work with a medical team and sleep specialists to make sure you're getting the right treatment and it's designed properly to fit that. So if you'd like a snore screener consultation, don't hesitate to call or text and we'd be happy to set that up for you. So thanks for watching and we'll catch you on the next one. Have a great day.